Which drug is often used when a patient has a penicillin allergy? Macrolides, erythromycin, azithromycin. Which drug causes a medication interaction when taken with milk, antacids, and magnesium-containing products? Tetracyclines. What adverse effects is a concern with aminoglycosides? Gentamicin. Otoxicity, nephrotoxicity, and hypersensitivity. How should the nurse monitor trough and peak levels in a patient receiving aminoglycosides? Gentamicin, streptomycin, neomycin. Peak levels, 30 mins after administration of infusion. Trough levels, 1 hr before next scheduled dose. What are the three interactions of aminoglycosides? Coumadin, penicillin, and loop diuretics. Which drug inactivates aminoglycosides when mixed in the same form? Penicillin. What education should the nurse provide to her patient who is prescribed gemfibrozil? Take orally 30 minutes prior to meal. Administer 1 hr before, or 4 hours after taking bile sequestrants. What type of drink interacts with statins by increasing statin levels? Grapefruit juice. Name a cholesterol absorption inhibitor. Ezetimibe. What are the adverse effects of ezetimibe? Hepatitis. Myopathy. How is it administered? Used alone as an adjunct or in combination with statins. How should statins be administered? Without meals, in the evening. Why are statins administered in the evening? Most cholesterol is synthesized when dietary intake is low asterisk. Niacin, which is used for PTs with pancreatitis and elevated triglycerides, produces what serious adverse effects? Hyperglycemia. Hepatotoxicity. Hyperuricemia. A nurse is assessing a patient with digoxin toxicity. What should the nurse expect to see? Nausea and vomiting. Dysrhythmias. What medications are contraindicated for a client taking digoxin? Loop/thiazide diuretics. ACEs and ARBs. Verapamil. Quinidine. A nurse is reviewing the morning laboratory results while preparing to administer a client their dose of digoxin, lanoxin. Which result would the nurse need to report to the provider? Sodium level of 144 milliequivalent/L. Potassium level of 3.4 milliequivalent/L. Calcium level of 11 mg/dl. Digoxin level of 0.5 ng/ml. Potassium level of 3.4. Hypokalemia can lead to digoxin toxicity, dysrhythmias. A nurse is monitoring patient compliance with the diabetes mellitus treatment regimen. What value indicates compliance with the regimen? HbA1c of 4% 6%. This is the best indicator of average blood glucose levels for the past 120 days. A nurse is taking care of a client prescribed omeprazole, Prilosec. What information should the nurse provide regarding administration of this medication? Take medication in the morning before breakfast. A nurse is to administer nitroglycerin for the treatment of angina. What should the nurse advise the patient? To sit or lie down. A clinic nurse is preparing to administer a penicillin IM injection to a client who has never taken the medication before. What should be included in the plan of care? Instruct the client to sit in the clinic for 30 minutes after the injection. To ensure prompt treatment if anaphylaxis occurs. A nurse is caring for a client with a history of rheumatoid arthritis who is receiving methotrexate, Rheumatrix. What should be included in client education? The CBC will be monitored. Bone marrow suppression is a common side effect of using methotrexate for long-term therapy of RA. A client is prescribed digoxin. What are the signs of toxicity? CNS effects such as blurred vision, diplopia, and white halos around objects are a sign of drug toxicity and clients should notify provider immediately. NNV, dysrhythmias. A client ingested a full bottle of imipramine hydrochloride, tofranil. What toxic effect is most important for the nurse monitor? Arrhythmias. With a tricyclic antidepressant, TCA, overdose, there is a high risk for serious cardiac problems, including arrhythmias, tachycardia, and myocardial infarction. What herbal supplement increases the effect of warfarin and could cause uncontrolled bleeding? Ginkgo biloba. A client with a recent myocardial infarction is prescribed digoxin, lanoxin. Which of the following findings indicate to the nurse that a therapeutic response to this medication has been attained? A rise in central venous pressure. A decrease in urinary output. An increase in apical pulse rate. A decrease in pulmonary crackles. A decrease in pulmonary crackles. Heart failure exists to some degree in all clients with myocardial infarction. Crackles would be present due to left-sided failure and passive reflux of blood leading to pulmonary hypertension. During administration of vancomycin, vancomycin, 4, the nurse notices the client's neck and face becoming flushed. What action should the nurse take first? Slow the rate of infusion. A client is prescribed lisinopril, Zestrol. What is most important for the nurse to assess before administering this medication to the client? Serum electrolytes. Adverse effect of ACE inhibitors is hyperkalemia due to its potassium retention effects. A client diagnosed with depression has been prescribed fluoxetine, Prozac. What information should the nurse emphasize about timing of the medication? Take the medication in the morning, as insomnia is a side effect of SSRIs. A nurse is providing discharge instructions for a client who is taking atenolol, tenormin. Which instructions should the nurse give to the client to prevent postural hypotension? Move slowly when changing from lying to standing. Taking tenormin at bedtime will help with symptoms of postural hypotension, which is a common side effect of beta blockers. A nurse is to administer morphine sulfate 10 mg intramuscular, IM, to an adult client for post-operative pain. Which injection site is the most appropriate? Ventrogluteal. This site is a deep site, situated away from the major nerves and blood vessels. This site is preferred for medications, such as antibiotics, that are larger in volume, more viscous, and irritating for adults, children, and infants. This site is safe for all clients with large muscle development. A client is prescribed lisinopril, Prinival. What finding indicate to the nurse that the client is experiencing an adverse effect of this medication? High potassium level. ACE inhibitors may cause hyperkalemia. Suppression of angiotensin II leads to a decrease in aldosterone levels. Since aldosterone is responsible for increasing the excretion of potassium, ACE inhibitors can lead to elevated serum potassium. Carbamazepine is used for what conditions? Epilepsy and bipolar disorder. What are the adverse effects of carbamazepine? Side effects? Risk of Stevens-Johnson syndrome and bone marrow suppression. Sides: liver damage, thyroid damage, drowsiness, nausea, blurred vision, dizziness, and dry mouth. What is an adverse effect of ticlopene, Ticlid, a platelet aggregation inhibitor? Pancytopenia, reduction of WBCs, neutrophils, RBCs, and platelets. Neutrophils equals 2,500 to 8,000 cells/mm3. What are lifestyle modifications that can improve symptoms of GERD? Avoid spicy foods, weight loss, smoking cessation, elevated HOB. What is a side effect of heparin? Thrombocytopenia, decreased platelet count. What should the nurse assess in a patient taking oral contraceptives? Blood pressure, hypertension. A nurse gives a patient an injection of Depo-Provera. What are the common side effects of this contraceptive? Weight gain, decreased bone density, increased spotting and amenorrhea. How does nitroglycerin work? Vasodilation causing decreased preload/decreased CO. How should the nurse apply a nitroglycerin transdermal patch? Apply to a hairless site, chest/upper arms, and let sit for 14 hours, remove for 10 to 12 hours to prevent tolerance. Rotate sites daily.